Now, today I will be dealing with most commons. Basically, these are the questions which are repeated as one-liners and are memory-based questions. And a small chunk of questions recently has been asked from these types of topics. So, first of all, what are the most common organisms? So, we deal with acute bacterial endocarditis. Acute bacterial endocarditis is a clinical entity which is very serious. We are not here talking about subacute. So acute, you know the organism Staph aureus. Staph aureus, which is implicated in many conditions like food poisoning, like staphylococcal scolded syndrome, like acute mastitis, like acute hematogenous osteomyelitis. In a similar manner, Staph aureus is the most common organism for acute bacterial endocarditis. Once we say something about acute, there is something which is subacute as well. And you should remember that Streptococcus viridans, which is different from staph, is the most common organism for subacute bacterial endocarditis. Now, as far as arthritis are concerned, especially in young sexually active individuals, the most common organism in bacterial cause of bacterial arthritis in young males is Neisseria gonorrhea. So that's very important. And many of the times this has been got wrong by the students who appear in the exams, and this question has been repeated many a times. So this is important. And bacterial meningitis, the most common organism in case of bacterial meningitis, especially in elderly, is Streptococcus pneumonia. This question has been asked from a geriatric medicine viewpoint, and you remember the organism Streptococcus pneumonia. As far as the newborn are concerned, the most common organism in bacterial meningitis in newborn is E. coli. So this gram-negative organism is the most common in comparison to gram-positive, which is the case in most of the cases. But over here, it is the gram-negative E. coli. Now, most common organism in bacterial meningitis in toddlers is Haemophilus influenza. So that is very important. You have to distinguish these things. And in young adults, it is the Neisseria meningitis. So that is very important. So you have to know which age group and which is the most common organism involved in case of bacterial meningitis. Now, as far as epiglottitis is concerned, Haemophilus influenza B, though there is a lot of vaccination going around Haemophilus, but it used to remain a very common organism for acute epiglottitis. Food poisoning is usually due to Staph aureus, as I mentioned earlier. And most important organism in the gastrointestinal tract is bacteroids. Bacteroids are a group of organisms, and they are very important as far as GI infections are concerned. Now, as far as drug abuse is concerned, which is a trend commonly, and the most important organism in IV drug abusers, which cause bacteremia and pneumonia, is the Staph aureus again. So Staph is very much having a predilection towards IV drug abusers. And especially, we will also come across some of the important organisms which are a cause of pelvic inflammatory diseases. So in young adults, the pelvic inflammatory diseases, the most common organism is Neisseria gonorrhea or chlamydia. In different countries, somewhere the presence of Neisseria gonorrhea is more common, and in other countries, the chlamydia takes a lead. So this is very important as far as the emerging trends of most common organisms are concerned. Thanks a lot.